am so fucking excited to film this video. I have my vape ready and I have my questions ready to answer. I mentioned that I wanted to do a Q&A based on plastic surgery itself, so you guys went ahead and asked me questions on my last Instagram post talking about, you know, the information that you want to know on plastic surgery, the prices, if you should go out to Colombia or not. I'm really happy that I'm able to inform all of you guys about, you know, the research that you need to do with plastic surgery, because plastic surgery is so much more complicated than you actually think. I also wanted to say that if you are somebody who doesn't believe in plastic surgery and is against plastic surgery and you're not about that life, I'm happy for you. I would just like for you to click out of this video, because I feel like a lot of people always feel ashamed to talk about plastic surgery, or are ashamed to go get something done because their sister or their cousin or their friend or so and so is like talking shit about, oh, you know, she's about to get plastic surgery. You know, we're just not about that, and I don't condone plastic surgery bullying here, so y'all can fucking leave. I'll block the comments if I have to, but for the most part I'm gonna go ahead and try to answer all of the questions that you guys asked, because there were so many. What's a trip is that guys were even commenting about questions regarding surgery for their girlfriends, so I thought that was cute. I'm just gonna go ahead and pull all of them up and let me know what you guys think about this video, if I do decide to block comments or not, because, you know, I want you guys to feel comfortable about getting your plastic surgery. And I feel like if you're insecure about something and you feel like this surgery is going to help you feel more confident about yourself and love yourself a little bit more, I would totally recommend for you to do it. Like, if you ever feel kind of iffy about getting your work done, come back, watch this video. Or if you've already been getting work done and you feel like you want to laugh or just, you know, talk about it a little bit, come watch this video, because I'm that bitch to tell you to do it. I'm that bitch to be like, fuck it, like, just do it, you know? Who cares? And also, who is to say that somebody doesn't love themselves because they decide to get plastic surgery done? Well, I'm here to tell you that I love myself enough to take my ass to go get plastic surgery. I'm just gonna go ahead and get right into the questions. I am a little bit litty, so if I stutter or if it's kind of hard for me to talk, that's probably why. All right, let me just start pulling up some questions. Most of the comments, I believe, were left was on the picture where I had said that I had just gotten my chin done. And a little update on my chin right now, I'm still a little bit sore, a little bit swollen. What I got injected in my jaw is called Voluma, and Voluma is a filler that lasts about 2 years. So it's one of the fillers out on the market that is able to add volume to your face, hence the name Voluma. They give you consent forms also before you get anything done, so you sign and you understand like what can go wrong, if you might be allergic to the product. But anyways, I got 2 syringes of Voluma in my chin, and the reason why I get my chin done is to elongate my face, also to give me more of a chiseled look, because I don't know if you guys have seen like pictures of me like floating around. Sometimes my fan pages post up like pictures of me from years ago, and my face como se ve más like chiquita and my cheeks look a little bit more fuller. So since I had gotten my lips done, and I've been getting my lips done for, I want to say, a good 2 to 3 years, made my chin even smaller. So adding Voluma like to your chin just makes your face a little bit longer. It evens you out. I'm like looking at myself on the on my phone. As you can see here, like I have a little bit of some dents right here. Dents are normal. Like, it's really normal to get filler done and then you still have the bolas, and the bolas feel hard. That should even out within like 2 weeks to a month. You have to just make sure that you keep massaging it, and eventually it just all blends out beautifully. The doctor that I went to told me that if I didn't like something, that like he'll go ahead and do a revision for me at no charge. But yeah, that's why I got my chin done, and I feel like I still need a little bit more on one side. That's the thing with filler, like no va salir perfect the first time. And when you start getting into plastic surgery, just know that like once you get into the industry, like you're gonna keep going back to get things done, and it's perfectly fine. Like, don't feel like, oh my god, like I'm addicted or whatever. Like, who cares? Obviously you have to make sure that you do your research well enough so you don't get botched, and you go for a really natural look. And if you like the fake look, do whatever makes you happy, like straight up. If you want a big ass and a small ass waist, you go get yourself a big ass and a small ass waist. Who am I to tell you what to do or what not to do? Like, I'm just here to inform you a little bit about the industry, do's and don'ts. Okay, this is a good question. What made you or helped you gain the confidence to do plastic surgery and not care what people had to say. Had been wanting to get my boobs done since I was a little girl. Like, I've always wanted to get my boobs done. I would look at girls who had big chichis on TV, and then I'll be like, oh well, since I'm little, like, I'm gonna grow my boobs later. I waited and waited and waited and waited, and before you know it, I was 18 and I still didn't have chichis. So I want to say, once I started making a little bit of money, I think I was still working at Sally's, I started to do research online to see how much breast augmentations were, and I started making consultations in different areas. I looked in Newport, I looked in Orange County, I also looked into Beverly Hills. You know, it took me a good 2 years to finally decide which doctor that I wanted to go to, and even then I kept switching doctors. You know, I would go in for a consultation, see how nice the facility is, if the people are nice to me, what type of certification that the doctor has, because I know that there's different types of certifications. It's always good to go with somebody who is reputable, and when I say reputable, I don't mean like they're insta famous online. I mean like their work is considered good. You've done research on the reviews that they put up online, all those websites where they do talk about their opinions on the doctors that they've once visited. So I never really cared about what people had to say. You know, I was never going to let somebody's opinion dictate what I do with my body and my life, because everybody that I have ever met in my life has wanted to get their boobs done. Like, I've never met a person ever in my whole entire life that said that they didn't want to get something done. So the fact that like I see people talking shit online, I'm like, they're fucking liars. Like, they want to get something done. And it's crazy because they probably don't even realize that they're insecure about something. But it's okay to talk about your insecurities, you know. Like, you don't have to like me, but let me know what type of insecurity you have, and then I can help you what it is you need to get done, or if you can work it out, or, you know, it just all depends on your goal body that you want. But working out is cool, don't get me wrong, but if you're trying to get like a Colombian style fake body, you are not going to get that working out. You can do a million squats, you know. But sometimes people aren't born with like an okay figure. Like, sometimes some girls are born with an okay figure, and then they weight train, and then they get a big ass and nice thighs and a really flat stomach. There's nothing wrong with that. If you can work out for that body, dude, go ahead and do it. But that takes a lot of time. It takes a lot of dedication. You have to make sure that you keep up with your dieting and everything, because I have been weight training for a while. I've been weight training for years. Ooh, since I was like back in high school, and when I was in track, and when I was in volleyball. But what I'm saying is, like, if it doesn't fit your lifestyle to be working out all the time, you know, surgery is a better route for you. And surgery, you can't just get surgeries if you're not at that proper weight. Like, you can go in for a consult and be overweight, and they're going to tell you, we cannot do surgery on you until you lose a certain amount of weight. So either way, like, working out, you still have to incorporate it into your lifestyle. But sometimes some people need that extra push to get work done first, recover, and then start working out. Some people are born with the really small butt, and some people are born with the really big butt. But just because that girl is born with the really big butt, it's telling you, no, don't get work done, just work out. But you have a different vision in your head, like, no, I want to go to this doctor because he's really good. I've already seen his before and afters. You don't have to let anybody fuck with your mentality. Do you know what I mean? Like, if you want to do it, you go ahead and do it because you want to, not because this person says, hey, no, you're too pretty for it. You know what? Like, if that person is not the type of person who knows about plastic surgery, who isn't planning on getting plastic surgery, you just don't talk to them about plastic surgery. You keep that shit to yourself. Talk about it with people online. Talk about it with people who have gotten work done and who understand the industry. At the end of the day, it is your decision, and you do risk your life getting these procedures done. But I feel like, since I've been through it and I know what it takes to get something done and save up for it financially, and then recovering from it, it's a really hard process. Like, it's not just something easy. And I feel like, you know, people always talk shit about people who flaunt their body online because it's fake. If it's fake or not, if you have it, flaunt it. What the fuck? And if you feel confident with your non-plastic surgery body, flaunt that shit too. But go ahead, people. Mira, do this, keep doing that, like, live your life like that. People that live their life doing this never progress. Like, really think about it. All those people that just do this, look at where they're at. Are you making it? Like, are you making 6 figures a year? What is you doing? You know what I mean? Like, are you educating people? Are you inspiring people? Next question. How to know the boob size that fits you? because yours looks bomb? Okay, this is a good question too. Now, I would recommend for people to save the pictures of the boobs that they like on whatever model they're seeing, whether it's an IG model, whether it's a magazine. You can't go into your consult and sit down to talk to your plastic surgeon about, oh, I want bigger boobs, because there's different styles of boobs. The right way that you're able to pinpoint exactly how you want your boobs is by saving them. So if you think my boobs look good, then, you know, save my pictures. If you think, I don't know, whoever's boobs look good, you like those, you know, because there's high profile, there's low profile, there's really squished in together, there's different styles of boobs. Also, there's different sizes. Do you want big boobs or do you want little boobs? And you also have to take into consideration, are you planning to get your body done as well? Because you don't have to get really big chichis. If you're going to get your body like liposuction your waist and get it transferred to your thighs or to your butt and your hips, you don't have to go that big. Or if you want like a really dramatic boob, you know, then you're going to tell the doctor, I want really big boobs. But you really have to determine if you want them to be high profile or if you want them to be more of a natural look, to do a low profile. You know, a lot of people always say that my boobs are low, but I told the doctor that I wanted them to be that way because I wanted to be able to have natural looking boobs while I'm naked or when I'm doing like photo shoots that are considered more high-end, because in a lot of high-end photo shoots, most of the models don't have a boob job. And since I've been in the modeling industry, I wanted to still have a natural body sometimes, but still be able to have like really perky boobs. Like, yeah, they're low because I'm not wearing a bra. Like, technically everybody's boobs are low when you're not wearing a bra, but when I'm wearing like a really push-up bra, like I can make them look really huge. So I liked to get this size because I have the freedom to play around with my look. I don't always want to be like, look at my fucking big ass tetas all the time, because I have a family. Like, if I'm near guys like that, I'm gonna be covered up. Like, that's weird being around my dad or my tío or my brother with my chichis all out. Like, that's fucking weird. And then the size of the boobs that I got done are 350 cc's. I did get silicone, and I got my scar right here. This is where I got my incision, and yes, my scars are still visible. You can use like scar treatment, but for the most part, scars are going to be there. You need to wrap your head around like you're going to have a scar, and scars are normal. Like, who gives a fuck? You have scars all over your body. Okay, here's another question. Do you think it's better to get plastic surgery here in the USA or go out of the country, like to Colombia? Because I've heard someone say it was cheaper outside of the country. I have never been to Colombia, or personally I wouldn't be the type to like fly out to Colombia to get work done. Not because I don't want to, but because like I have a family here and I will feel bad like, recovering outside of the country and leave my son here. I don't know, like I just feel weird leaving Emmanuel and the baby alone for too long. And when I'm recovering from a surgery, I like to be here still at the house. Do you know what I mean? But I do have a few friends that have gotten work done in Colombia, and I personally love the workout in Colombia. It's very exaggerated, very small waist and a really big ass, and I think that looks fucking bomb on girls. Like, if I had a thicker body and I was a little bit fatter, I would get that type of body done. But since I'm skinny, like getting worked on my style of body is a little bit more difficult because it's hard for me to gain weight. And in order to get these surgeries, the doctor recommends for you to gain a certain amount of weight. And for us skinny girls, it's really difficult to gain weight, which is why weight training and also trying to gain weight, like I'm eating everything in sight and everything, because I do want to get another procedure done that involves fat in my body, because I want to get like sculpted or whatever. If you want to get worked in Colombia, I would totally recommend it. If you're single and you're fucking don't have kids, I would totally recommend for you guys to go over there. But before you decide to go over there, please make sure that it's a doctor that is reputable. I know that doctors, like, they're always informing their customers on their Instagram. Make sure to call, make sure to hit up somebody, like, you know how they post up before and afters, find out who that girl is in the picture and follow her and ask her questions like, hey, is it legit? Bad shit can go wrong even here in Beverly Hills with plastic surgeons que según they know what they're doing. You do it at your own risk. If you really feel like your heart is telling you to go, obviously don't be a pendeja and like the first doctor that you find, oh, I'm flying out right away. No, it takes years to finally figure out which doctor it is that you want, because you have to make sure that like when you're looking at before and after pictures of the people that plastic surgeons post up on their Instagram, you know, a lot of the times they're naked and they're not fully clothed. So naked looks totally different than fully clothed. And that's when I feel like people often come out of surgery upset because their boobs aren't big enough how they want it. You know, you have to really take into consideration doing your research, like, hey, should I go a little bit bigger, or should I gain a little bit more weight, or should I lose a little bit more weight? It's just a trial and error type of thing. Usually for breast augmentations, I would recommend for you to go a little bit bigger than you originally planned, because most girls, like everybody that I know, always says, I wish I would have gone a little bit bigger. The best thing that I love about getting my boobs done is that I never wear bras anymore. Like never do I wear bras. What made me the most happiest about getting my boobs done, also I will add, is I'm able to wear low cut dresses. I can wear any type of shirt, like anything that I want to wear, I wear it. And sometimes I do like for my nipples to show, so I just like let them be because I paid lots of money for them. For those of you guys who are wondering how much I paid for my boobs, I remember it was around $10,000 with Dr. David Kim. You guys can go ahead and check out his Instagram, go take a look at his work. He's a very busy doctor. I feel like he's one of the most popular boob doctors in Beverly Hills, and just have a bunch of questions to ask him. But I would recommend for you guys to go in there already knowing what his work looks like, so you guys don't waste his time, because there's a bunch of people that go in there. So you want to make sure that you ask him questions that are really going to help you decide if you want to get it done or not. And feel free to book multiple consultations. Like, this is your body, this is your health, and you guys, recovery is a bitch. I am going to say that it is a fucking bitch. So you just want to make sure that you really think about that this is what you want to do. Like, make sure to think about it for a year, if not 2 years, so that way it gives you time to save up money. It gives you time to you know, make changes in your diet if you have to gain weight, or if you have to lose weight, or if you are overweight and the doctor told you that you need to lose weight before you get your surgery. That's fine, don't worry. Change up your diet plan, drink more water, no more sugar, no more carbs, do hella cardio, take your vitamins and stuff, because you really need to be fully healthy before you go in to get surgery, you know. And you do have to take physicals, and you do have to get blood work done in order for the doctor to even consider you to be a patient. They make you sign a bunch of fucking paperwork, all the risks. Also, a huge risk about getting your boobs done is that you run the risk of losing your sensitivity in your nipples. And I did lose my sensitivity on one side, and for 6 months, like, I felt nothing, and I was so sad, because I knew that that was a risk. And at that time I was like, fuck it, like, I just want big tits, you know. But then when it really happens, it gets sad. But I wouldn't have not gotten my boobs done. Like, I fucking hated having a flat chest. Like, I'm into fashion, so I would get really sad when I would go into the dressing room, and I would want to look sexy for the night if I had a baile, or if I had a date with a guy or something. I would try on clothes, and the clothes wouldn't look cute because I have a flat ass chest, you know. And if you feel like you look cute with your flat chest, like, dude, there's some sexy ass models who are bomb as fuck with no chichis. I just always felt like I wanted big boobs for some reason since I was little, and I wasn't 100% happy with myself until I did get my boobs done, because I was able to fulfill my dream of being able to wear certain things, you know what I mean. So if it doesn't apply to you, you don't need to go get your boobs done. Also, like, I was super insecure when I would have sex. Like, I didn't want to take off my shirt. Like, it was just uncomfortable for me. I didn't want to have the lights on. And it also helps your relationships that you have, like with people that you're having sex with or whatever. My nipple's itchy, sorry. Getting my boobs done was the best decision that I have ever made in my life, and I'm here to tell you, if you want to get your boobs done, I 110% recommend it. If you want to get your lips done, I 110% recommend it. If you want to get Botox, I 100% recommend it. Please don't get carried away. There's a difference between loving it and then obsessing over it. I think that's when people start to say, oh, like, you don't love yourself because you're putting yourself through that. I totally understand where you're coming from, but I just think life is all about a balance. Like, a little bit at a time is okay, you know. I don't want you guys going broke tampoco, like getting your work done. And also, plastic surgery outside of the US is so much more cheaper. I hear that you can get like your body done and your boobs done y que no sé qué for like 4 G's, and then when you purchase tickets and everything, I'm sure it rounds out to like 8 grand, because out there they actually have homes where they take care of you y te hacen tus comidas and stuff. Out here in Beverly Hills, they don't do shit like that. And if they do have places like that, which I've never heard of, it's probably really expensive. Here in the US, they do your surgery y te sacan pa fuera, like real quick. Like, they fucking let me go really quick right after my surgery. Like, they didn't even give me like un little pain med. Like, for my way home, my anesthesia had ran out when I was like driving back home from Beverly Hills right after my surgery. So I had to go to the ER, and then they injected me with like pain meds and shit. But it was my fault too that I didn't bring my pain meds the day of the surgery. Please remember, if you guys are getting your surgery, do not forget all the pills that the doctor has prescribed you to purchase, because you need to start taking your antibiotics right away after you get out of surgery, because as soon as that anesthesia wears off, the pain starts to kick in, and you just feel like you're dead pretty much. Like, I don't handle pain well. Like, I'm the type of person, if I feel sick or if I feel some type of pain, I'm like, I don't feel good. Like, I need to lay down. Like, I need for somebody to like be there for me and like hug me and like make me soups and like tell me that I'm pretty, massage my feet. A lot of people, like 98% of people, always fall into depression during their recovery, because you're just there like a potato at home, like eating your soups, making sure you're getting your rest, you're on pain meds, you're taking antibiotics, and like I'm talking like you're taking pills every few hours, you know what I mean? And then you're bleeding or you're uncomfortable and you can only sleep a certain way. So it takes a lot of sacrifice during the recovery process of getting any type of work done. Like, even when you get fillers too, como que te atarantan, because whenever I get my Botox or I get anything done, like my lips or anything, that whole day, like my head hurts, I feel groggy. So I would just recommend for you guys to take it easy before and after any procedure. And filler, you guys, there's nothing to worry about with filler. Like, filler is the easiest thing to have to go through compared to surgery. Surgery is obviously much more of a risk, but I mean, it is painful. If you're scared of needles, what I would recommend for you to do is just relax the whole time. But I would say don't let the fear of needles get in the way of you getting your lips done or getting your chin done or anything you want to get done on your face, because it's not as bad as you think it is. Like, I'm terrified of needles. When I get my blood taken out, I can't look at them doing it because I feel like I'm gonna pass out. So I just kind of like look away. When I get my fillers done, I make sure that I don't even turn around to look at the needle before it goes into my face, because that's when I start to freak out. Because I think everybody has a fear of needles, because it's fucking nasty. It's a palo going into your skin. Like, that's fucking weird. And when I went to get my chin done, since he was going like super deep, like the doctor has to go super deep to inject the filler, because the deeper it is, the longer the product lasts. Like, if they do it like super up here, no te va a durar tanto, because I have gotten my chin done about 3 to 4 times already in the past year, so my body type absorbs the filler a lot. Also, that's another thing you guys have to keep in mind. A few of you guys were asking like, oh, how often do you have to get it done? How long does the filler last in your body? Everybody's different. A person's filler might last 6 months, somebody else's filler might last a year, somebody else's might last 2 years. You know, it just depends. You yourself look at yourself every single day in the mirror. If you feel like your filler has been going away, then it's time for a touch-up. Like, it's normal to feel nervous, because every time I go get my fillers done, I always get so nervous, and I've been getting my fillers done for years, you guys. Also, I would totally recommend for you guys not to get numbing cream, and the reason why I say that is because the doctor that I've recently been going to, he doesn't use numbing cream. He just uses ice, so you can numb it a little bit. So request ice. The reason why I say to not use the numbing cream is because when you use the numbing cream on your lips, it already makes your lips look a little bit bigger. So by the time that the injector goes in to do your lips, it's already distorted, because your lips are already a little bit swollen. So when she goes in, you can't really tell if you have enough filler or not. Do you know what I mean? If you feel like you're super duper duper chicken, go ahead and get it, and just do a little bit at a time, you know, because you could always dissolve the filler. Like, don't be scared. If you really don't like it, you can always go back and they'll dissolve it for you in no time. You'll just be down for a few weeks. I'd say like a week at most. Just keep icing it. But if you've never gotten your lips done and you want to get your lips done, just know that like you're going to be swollen, especially if you get like one full syringe and you have no lips. You're going to be swollen. I was swollen for like a good 2 weeks, and I was freaking out because my lips were fucking huge. They were purple, like I couldn't really talk, you know. So not being able to talk and stuff, like, that's totally normal. Once you get used to it, you're not even gonna give a shit. Like, yeah, my face is bruised, I get filler. Like, it's better to flaunt it than to hide it and be like, oh no, I don't get work done. You know what I mean? But I totally understand why people aren't open about getting work done, because hella people talk shit online and it's so annoying. Like, how are you gonna be on Instagram just talking shit? Like, what are you doing? Somebody asked, would you ever get a nose job? Nothing wrong with your nose, just asking. I have actually considered getting a nose job. I wouldn't necessarily call it a nose job, because a nose job is kind of going in to drastically change your nose. Now my nose doesn't look big because I'm obviously contoured. I have on my big ass lashes, you know what I mean? But if I had never gotten this filler done right here on my face or never gotten my lips done, my nose would look even bigger than what it is. And a lot of people do ask me if I've ever gotten my nose done, but I have never gotten it done. If you enhance other parts of your face, your nose will appear smaller. But yeah, I have considered getting my nose done, just kind of like chipping off this little piece right here, kind of contouring it. I guess you could say like nose contour. If you contour your nose every single day and like are super insecure about leaving your house without contouring your nose, you're most likely a good candidate for a nose job. But please ladies, 1 to 2 years of research. Don't do research on a doctor within a week and be like, I'm gonna go get work done, because that's when you're more prone to being botched. So keep that in mind. Those are a few of my rules when it comes to getting plastic surgery. I'm talking so much. I don't know how many questions I've answered, but I feel so winded because there's just so much information that needs to be put out there for you guys to understand and not be so scared of the plastic surgery industry. I feel like we need more people like me who can feel okay with talking about it, so that's why I'm winded. 2 more questions, you guys. I promise I will make a second video to this, and then I'll have you guys ask more questions based on you guys already watching this first video, so that way the questions can get a little bit more different than the basic ones, you know. There's certain levels to plastic surgery, I swear. And the only procedures that I have had done like on myself is just my boobs. I've gotten my chin done, I've gotten my lips done, I get my laugh lines filled also, and then I get hella Botox on my forehead, and that's it. Do I plan on getting more plastic surgery? Yes, I do. I'm looking into a few things right now, and I will talk about that in a separate video because this is just too much for me. Okay, so somebody asked, why did you get your chin done again? What didn't you like from the first time? Now, I have always liked all of my chins that all the doctors have done on me, but the only thing is, like, it starts to dissolve because filler doesn't last like forever. So you have to understand that if you're planning to get a chin done with filler, that you're going to have to keep getting retouches because your body absorbs the filler. Now, if you want to do something more permanent, you can look into doing jaw implants. They have jaw implants for the side, and they also have jaw implants for the front. Have I wanted to get a jaw implant done? Yes, I have, but the doctor was just telling me that like it's better to do filler, just because like my type of situation is a little bit more complicated because my face is very square, so he has to start filling in from this side all the way to over here, and I'm not sure if there's implants that are that big or if it's like a small chin implant and then 2 more implants right here on the side. So, you know, I just have to keep doing my research. If I want to do something more permanent, I'll look into that in the future, but for now the filler is working for me, and it's much cheaper because when you go in to get your chin done, it's still like a surgery, so you have to be put to sleep and all that stuff. I'm not sure if you can do local anesthetics or just regular anesthesia where you're officially asleep. How do you feel after waking up from surgery? Did the anesthesia give you anxiety? Were you out of it? So when you wake up from anesthesia, it literally feels like you just woke up from a nap. Like you kind of remember that like you were going in for the surgery, and then you're just like, oh shit, like the surgery already happened. When you get put under anesthesia, it's not as scary as everybody says that it is. You literally feel like you're drunk for like a moment, or high, crossfaded, and you're just out. Like you just completely fall asleep, and it feels like you fell asleep for 2 seconds and then woke up. You don't feel shit. And during the consultation with the doctor, I made sure to tell him that I'm prone to nausea, so I told him to prescribe me nausea medication so that way I can take with the pain medication and also the antibiotics, because too much pills makes me nauseous. So ask your doctor to recommend for you to take Zofran. Zofran is an anti-nausea medication that you can take, and it's 100% safe for you guys to take it. And then also he prescribed me a pill, and I know some doctors prescribe an actual patch for anti-nausea right after you wake up from anesthesia, because some people do really bad under anesthesia and they'll be shaking, and like some people wake up throwing up and shit like that. So when you guys wake up from anesthesia, I want you guys to stay relaxed and keep breathing in and out, because sometimes if we let ourselves get into our head, like we make ourselves panic a lot, and you know that can do you bad, causing you to be nauseous, because I have a phobia of throwing up. So like with that medication that he prescribed me, I took it right before I went into surgery, and I didn't feel nauseous at all. I was just like really drowsy, like you're just kind of like still like like it's kind of almost waking up from a really bad weed hangover. Like you had a really strong edible and the next day you just kind of woke up like I'm just gonna go back to sleep and sleep until like 3 in the afternoon type of shit. Okay, I think that's been 2 questions, but let me see. So somebody asked, why do girls don't share their plastic surgeon info? Now, not everybody has to share their plastic surgery info. I feel like if you paid it and you underwent the recovery and everything, I feel like it's your personal privacy to keep it private. Don't expect for everybody to talk about it, and nobody has to talk about it. If people say that their body is real, I feel like I respect them enough to be able to live their life however the fuck that they want it. Now, that's why y'all have me. Like, I'm down to be open about it because I already have a lot of hate. Like, a lot of people don't like me, you know what I mean? But that doesn't change who I am as a person, and I'd rather help somebody get to their dream body type that they want. And I just feel like, I don't know, I have the balls and I have the courage and the confidence to talk about it, but girls don't have to talk about their surgeries. You guys have to really understand that. I wish more people would be open about it, but you can't force it, you know? I just feel like that's everybody's personal business. You don't have to tell anybody, you know? And hopefully, like, me being open about plastic surgery helps everybody be open about it. I just want more people to be educated on the topic. I'm gonna take off already because I still have to take a shower, and then I have to take off my makeup, and I gotta get ready for bed, and I gotta brush my teeth hella good because I have a cavity in the back, and I'm gonna get my wisdom teeth removed soon. Actually, I'm gonna get my wisdom teeth removed next week. I had mentioned earlier on my Insta Snap like 2 days ago yesterday that I was gonna get them removed, and a lot of you guys were like wishing me good luck and thank you. I think I'm gonna be vlogging the whole experience. I am gonna be getting put to sleep under anesthesia, so I'm not going to feel anything. It's gonna be like I'm going in for surgery again, and I hear that the procedure is really quick, so if I'm asleep, like I'd honestly rather be asleep, to be honest. I just don't want to feel the pressure of them pulling out my tooth, you know? All right, I'll see you guys all later. Bye.